Thank you for having me with you at your conference today. I'm sorry that I can't be there in person. Can I acknowledge Mr Scott Wagner, the President, Ms Gail Cummings, the Deputy President, Rod Wellington, the Chief Executive Officer, and importantly, ladies and gentlemen, all of the participants in this conference. Thank you so much for this opportunity to speak to your national conference, even if it's only through the wonders of video technology. I would very much like to have been with you in person in the beautiful tropical town of Broome. Unfortunately, as you're probably aware, this is a parliamentary sitting week in Canberra, and the current composition of the parliament requires me to be very close to the chamber at all times. And while I can't guarantee to provide the pearls of wisdom promised in the conference title, this opportunity does allow me to discuss the government's reform agenda for regional health and the central role that allied health services play in rural and remote Australia. It's also an opportunity for me to express the government's thanks to SARRAH for its strong, positive advocacy to improve the working conditions of rural and regional allied health professionals, and to thank you directly for your hard work to improve the health and lives of our rural and regional residents. Improving rural health is a key priority for me and for this government. And my central message today is that the best way we can significantly lift regional health outcomes is by getting more trained health professionals such as yourselves on the ground with the tools, continuing training and professional support that you need. So every action we're taking is geared towards this goal. We're boosting training and support to improve workforce distribution. We're taking responsibility for 100% of funding for primary health care to keep people out of hospital and to reduce waste. We're introducing nationally funded, locally run national health and hospital networks to give local communities more of a say on the healthcare services that they need. We're delivering an e-health system to improve continuity of care and make your jobs just that little bit easier. And we're improving data collection on allied health professions and locations of need. But of course, gathering statistics and introducing a comprehensive electronic record system will be of limited worth if we do not have or use them to get the necessary allied health professionals on the ground. That's why I was very proud to stand alongside the Prime Minister last week to announce funding for the clinical training of up to 12,000 more medical, nursing and allied health professional students to help deliver the health care that Australians need. 22 health and medical professions will benefit in remote, regional and metropolitan Australia, including nurses, midwives, dietitians, dentists and Aboriginal health workers. It represents a focus on expanding much-needed training places for undergraduates in those professions in highest demand, particularly in allied health fields. It's estimated that over 1.2 million additional training days will be supported each year from this investment, an increase of 23% from the 2009 baseline. For example, this includes an estimated additional 116,000 training days for physiotherapy, 21,000 training days for dietetics and 14,000 training days in oral health, just as an example. Approximately 37% of the additional placement days will be located in rural and remote areas, and 41% of placement days will be in priority professions such as aged care, dental, mental health, primary health care and community-based services. We've also introduced 400 more clinical placement scholarships for allied health students in rural areas, being rolled out through the Nursing and Allied Health Scholarship and Support Scheme. These scholarships support allied health students to undertake part of their clinical training in rural and remote areas, gaining hands-on experience in rural-based practice. And we know that the more students get a taste for rural and regional work, the more likely they are to take up a regional position at the end of their study. They've seen that their professional world can extend far beyond the metro boundaries and that the work they encounter is often much more diverse and rewarding. I was pleased that SARRAH, with a proven track record in delivering government scholarships, was selected to manage the allied health component of this scheme. The university departments of rural health are another important part of a long-term strategy to increase the recruitment and retention of rural health professionals and to improve rural and remote community health care. These departments encourage students of medicine, nursing and allied health disciplines to pursue a career in rural practice by providing opportunities for them to use their clinical skills in a rural environment and actively support health professionals who are currently practicing in rural settings. I'm also very aware of the difficulties that allied health professionals working in rural and remote locations have in taking off time to undertake professional development, and that's why we've established a rural allied health locum scheme. We've funded 100 locum placements per year in rural locations. The scheme will also provide metropolitan health professionals with opportunities to undertake rural-based practice through a locum placement. For many, this will be their first experience of working in the bush, and we have to make sure the necessary support is there for them so they keep putting their hand up to help regional professionals. Government-funded locum schemes already exist for doctors and pharmacists, but this is the first time we've supported the broader allied health workforce through a locum scheme, and again I'd like to pay tribute to SARRAH for its support and advice during its development. Another focus for the government is keeping people healthy and out of hospital. It benefits them and their community, as well as reducing the strain on our health system. That's why the Commonwealth will be taking responsibility for 100% funding for primary health care. This will end the duplication, waste and confusion for patients of the current overlap system between the states and the Commonwealth. Allied health professionals play a key role in our regional communities to prevent ill health and to treat and manage conditions before people end up in hospital. And as I mentioned earlier, we can only do that properly by getting more allied health professionals to the areas of greatest need. We're also implementing the National Primary Healthcare Strategy, the first of its kind ever attempted in Australia, to provide a guide to current and future policy and practice, as well as assisting in the development of the National Health and Hospitals Network. Earlier I flagged e-health as an important part of our efforts to provide allied health professionals and others with the tools that they need on the ground. As you'd be aware, we're in the process of introducing a universal, patient-controlled e-health system. This will be an incredibly valuable system for allied health professionals working in rural and remote Australia. E-health will reduce waste and inefficiency and improve continuity and health outcomes for patients. Electronic files will record details about medications, treatment for conditions, test results and other relevant information which will be available after the patient gives permission with a few clicks of a mouse. This takes the onus off the patient to remember what treatment they have had or what medication they were on, perhaps now or in the past. It will be of considerable benefit to older Australians, those suffering from chronic disease, and of course for Aboriginal and Torres Strait Islander people who relocate regularly. And importantly, it will reduce the professional risks allied health professionals have to deal with every day, making your work that bit easier and quicker. As I'm sure you're aware, data on the allied health professions is very limited. We must improve data collection if we are to properly measure the supply and distribution of allied health professionals in rural and remote Australia and to target those areas of greatest need. I'm pleased that Health Workforce Australia will work with the Australian Health Practitioner Regulation Agency to improve both the quality and availability of this data, and I encourage you to work with them too. There are a range of other ways government is helping to support allied health professions, especially those working or planning to work in rural and remote areas, all of which come back to the central goal of lifting the workforce in our regions and giving you the tools and support that you need. For example, in the 2010 budget, we committed to a network of Medicare locals to be built from the existing divisions of general practice. These bodies will work with medical, allied health, nursing and community health providers to provide better services, improve access to care and drive integration between the services. They'll also work with the new local hospital networks to improve the local integration between hospital, GP and primary healthcare services. In regional Australia, a flexible approach will be adopted to determine the regional, rural and remote network structure that best meets the needs of these communities, taking into account the challenges of managing multiple small hospitals. We're also putting the necessary infrastructure in place to allow the next generation of rural health professionals to stay in or to come to our regional areas and access the same level of training facilities as are available in the city. This includes, for example, 64 projects to expand clinical training capacity in non-traditional settings, especially in rural and regional areas, 22 new capital projects across Australia through the Rural Education Infrastructure Development Pool, 3 new rural clinical schools, taking the number to 17 across the country, and facilities to support the new Northern Territory Medical School and the James Cook University Dental School. These coordinated new projects will provide a major boost to our rural training capacity. We've also allocated $1.75 million to enhance the rural and remote allied health diagnostic imaging workforce, including through scholarships and support grants. To provide greater high-level coordination and support across the allied health professions, we're also supporting the establishment of Indigenous Allied Health Australia, and I'm very pleased that we're also able to assist SARRAH in its important coordination and advocacy role, including this national conference. So in conclusion, I'm very conscious that in outlining what the government is doing to help you fulfil your role in our regional areas, I do not portray our work as complete. The government is not now simply dusting its hands and saying job well done. Instead, we need to ensure that these major infrastructure projects, programs and reforms continue to be delivered in a way that works for you and for the next generation of allied health professionals. I look forward to working with SARRAH to boost Australia's allied health workforce and to improve your access to the tools, training and professional support that you need. And I'm very pleased to be continuing to work with each of you to ensure that Australians have access to world-class, comprehensive health care, no matter where they live. Thank you very much, and I hope you enjoy your conference in Broome. I do not work with each of you as allied SARRAH. I look forward 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 to work with each of you. I do not 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 work with